To you.
Well, it's interesting because I was listening to my friend from New York and the gentlelady from California. I can't get over what all the fuss is about against this bill. I mean, this is something that Bob Dole and Senator Chafee had worked out in the 80s. I mean, this is middle of the road stuff. I mean, many of us wanted other things in here. I mean, I'm not afraid to admit that, but there's no public option in here. This is not single payer. This is right down the middle. This is bread and butter, all-American, apple pie and Chevrolet. I mean, this is it. This is baseball. Look at it. Tax cuts for small businesses. We have many people in our district make $50,000 a year. Under this proposal, a family of four making $50,000 a year in Niles, Ohio, will get $5,800 worth of a tax credit. That is a middle-class tax cut. Now, this is what's in the bill. We are regulating and putting in new rules for the insurance companies. We're not taking over, but this is a pretty simple, and the gentleman from New York mentioned it. This is about prevention. There's no one who can argue with the fact, Mr. Speaker, that we have 30 million plus people in the United States of America have no preventative care at all, dumped into our emergency rooms, much sicker than they need to be. And it doesn't take a Philadelphia lawyer to figure out that that costs a lot of money, as opposed to giving each one of those, and they pay nothing. They go there and they pay nothing. They pay no co-pays. They don't pay anything. So it's all free, shifted off to the next person who comes in with a card, with an insurance card. What we're saying is it is cheaper for us as a country, since we're all already paying for these folks anyway, through higher insurance premiums. It's cheaper for everybody if we give them an insurance card and make them pay something. We're going to start getting some. No more free riders. Everyone's going to have to pay something. And get them to a primary care physician who will give them a $20 prescription drug instead of going to the emergency room a week or two later and costing us $10,000 or $15,000 or $20,000. That's what this whole thing is about. And when the insurance industry is set up now currently to knock people off the rolls and deny coverage, especially the stories we've heard coming out about people with HIV and AIDS, you're not covered. You know, that gets pushed off and dumped on everybody else. And so we're saying that this is a pro-business bill. And I'm glad, as the one gentleman said earlier, I'm glad that the teabaggers are in Washington, D.C. to watch this pass, because this is going to be the most significant tax cut for middle-class people in the history of our country, especially geared towards health care. And when I can go home and tell my folks that have a family of four making $50,000 a year that they're going to get a $5,800 tax credit for their health insurance, I think they probably don't know that right now, but I'm going to spend the next 6 months making sure every single family in my district knows that they're going to get that tax cut, and they're going to like what we have done here. And I yield back to my friend.
Thank you, Mr. Ryan. One of